right. Hey, everybody. Welcome to our first in a series of 5 videos that we're going to make about adverse childhood experiences. Today's lesson is the start of what we think teachers need to know about adverse childhood experiences. We're going to try to keep each video to about no more than 10 minutes long. So here we go. So the Adverse Childhood Experience Study was done by Kaiser Permanente. The 2 doctors who did it were Robert Anda from the CDC and Vincent Felitti from Kaiser Permanente. It was done in the late 1990s. There were actually over 17,000 volunteers from a health maintenance organization, so they were members of an insurance carrier. They decided to put the questionnaire for the ACES study in with basically like a general physical that the members were doing over the course of the period of time when they did the study. The participants were about half male, half female. 75% of them had some college. Many of them were graduates of college, and the average age was 57. So we're not talking about a certain age group. It was a pretty good range. The study revealed some really good information. 64% of the participants reported an ACE score of at least 1. You're going to get the opportunity to take the ACE questionnaire. It's going to be included in the email that we send to you. If you experienced 1, you had an 80% chance of having at least 1 more. And 13% had 4 or more. That was over 2,000 people, or 1/8 of the participants had 4 or more ACEs. You can see here that 16% of men and 26% of women reported childhood sexual abuse. When I was coming up through my master's program, the statistic was 1 in 7 males and 1 in 3 females by the age of 18 would experience some type of childhood sexual abuse. Notice that 2/3 of the women in the study experienced some type of abuse, violence, or dysfunction in their childhood home. As I mentioned just a minute ago, the ACES questionnaire is going to be sent to you via email. I do want you to know that giving yourself the ACES questionnaire and thinking back on your own childhood trauma can be somewhat triggering. So that's just my disclaimer that, it's sometimes a little maybe emotionally painful for us to think about what we experience in our own childhoods. But I do think it's an important part of thinking about what our students may be presenting when they come to school.
All right. Hey, Honey Island, Jill Gus here. I'd like to talk to you about the different types of traumas that were included on the ACES questionnaire. They can be broken up into 3 categories of complex traumas. We also call these big T traumas, and it includes abuse, neglect, and household dysfunction. Under abuse, we have physical abuse, emotional abuse, and sexual abuse. Then in regards to neglect, we're talking about physical neglect or emotional neglect. And finally, we're going to look at things that our students might experience or witness in the household. So, for example, having a parent or guardian who has a mental illness, someone in the household who is in jail, witnessing domestic violence, and also perhaps having a caregiver who is addicted to drugs, alcohol, and then, of course, experiencing divorce or separation of your parent, splitting up the family unit. So I also want to draw your attention to things that we call little T traumas. Each person and individual experiences trauma in a different way. And so some things that might be traumatizing for one person may not have the same impact or effect on another child. So some examples of little T traumas might be an injury, experiencing loss. Even loss of a pet can be very significant to a child depending on the circumstances of that loss. A death of an extended family member or grandparent that perhaps the child was close to. And I'm sure with your students and your experiences, you have seen other types of little t traumas. So there are actually quite a few that are out there, but these are just a few examples. Now, I'd like to draw your attention to some of the statistics regarding ACEs in childhood. About 25% of school-age children have been exposed to trauma. Okay, and if you actually take a look at the infographic here on this slide, this is representative of what a 30-person classroom could look like. It's just an example, and you'll notice that the first row, there might be no students that are exposed to trauma, but we start working our way up, and it looks like the majority of the students in this classroom have experienced at least one trauma, and you may even have a child in your class who has experienced 4 or more traumas, which is considered very significant. Now, we know from the ACES study that trauma is the #1 predictor of school suspension and the #2 predictor of academic failure. And that goes hand in hand with the fact that children who have 2 or more adverse childhood experiences are 3 times more likely to repeat a grade. We know in education, and if you have studied the book Yardsticks, that children who repeat a grade are much more likely to not finish high school and not graduate. So we know that that is very important to our work. 75% of children who were victimized reported more than one type of victimization. So we're talking if someone was sexually abused, much more likely to perhaps experience physical abuse as well. And finally, this statistic is really staggering. 90% of kids in the juvenile justice system have a history of trauma. So that's one common denominator there.
Jill, I have someone who's in one of the classes that I teach, and she works at Caddo Parish Correctional Facility, and she said she's never had a client who did not have trauma as a child. So that statistic is definitely real, even in our, obviously moving into our, penal system or penitentiary system.
I absolutely believe that. We want to draw your attention to the next few slides that talk about how ACEs impact health and well-being over the lifespan. And so even when our kiddos with trauma grow up, the trauma does not leave them. The effects continue. And so what I want you to notice is that individuals who have 4 or more ACEs are going to have a much greater impact on their health. So here you can see that women with 4 or more ACEs are almost 60% more likely to suffer from chronic depression. This is talking about suicide attempts. So individuals with 4 or more ACEs are almost 20% more likely to attempt suicide in their lifetime. When we're thinking about the ACEs score impacting teen sexual behaviors, kids who have 4 or more ACEs are almost 25% more likely to have an early sexual encounter before age 15. Girls who have 4 or more ACEs are about 40% more likely to become pregnant or experience a pregnancy. And young men who have 4 or more ACEs are about 35% more likely to become teen fathers. Smoking impacts all systems of the body and health overall. And individuals who had 4 to 5 ACEs were about 12% more likely to smoke in adulthood, and those who had 6 or more ACEs were about 16% more likely to smoke in adulthood. And whenever it comes to drinking, alcoholism specifically, individuals with 4 or more ACEs were about 16% more likely to become alcoholics. So we know that people who are hurting, if they do not receive the treatment that they need early on, that they will end up self-medicating. And this slide is very important to helping us see how ACEs and trauma impact a person over the lifespan. And what I want you to take away from this is that trauma can begin before birth. If you look at the bottom of the pyramid, where it says generational embodiment and historical trauma, what we're talking about here is that we have to look at the context of the family, the trauma that is already going on in the family culture that a child is born into, trauma that a pregnant mama goes through, that impacts the baby. The mama's stress levels can impact the development of the fetus. And so as the life cycle goes on, we see that what's going on in the community can impact a child. Then within their development and their growth, we have disruptions. The brain goes into flight or fight. Lots of toxic stress is impacting this child and how they respond to different events around them. And it can be very difficult for this child to keep up. And over the lifespan, as they grow into adulthood, we do tend to see these health risk behaviors, the things that we talked about, alcoholism, smoking,
substance abuse.
Yes, the substance abuse will impact that individual. And then we know from the ACEs study that individuals with higher numbers of ACEs, especially 4 or more, are more likely to have long-term health problems. And unfortunately, sometimes this can lead to a shorter lifespan.
All right, thanks for being with us. Our next video is going to be on ACEs brain science, and just to bring you some information about how ACEs impact the brain and how that causes some of the behaviors and attitudes that we see. So we'll see you next time. Thanks.